For more insight now into the healthcare reform process, I'm now joined live by John Goodman. He's the founder of the Goodman Institute. Thanks so much for joining us.
Glad to be with you.
Well, as you probably know, healthcare representing almost 20% of the U.S. economy. So every time the U.S. tries to reform the system, there's obviously an economic impact. So what would you say some of the economic reasons are behind the current effort to reform?
Well, what Paul Ryan is proposing to do is take $1 trillion in Obamacare taxes and simply repeal them. And what that would mean is giving back $1 trillion to really many of the special interests that gave us Obamacare, the drug companies, the insurance companies. What I would rather see them do is use that money, have a tax cut, but give it to individuals to help them buy health insurance.
Just to help our viewers understand, what did the last effort fail to do that's attempting to be addressed now? Because obviously there's a political side to this, but in terms of the economics, what did Obamacare do from an economic perspective, in addition to the tax issue, that people were trying to address?
Obamacare set up an artificial market, and they did it very imperfectly because they rushed it through Congress. They didn't think it through. Now, there's an opportunity for Republicans to come along and really improve on that. But mainly Republicans are saying we want to go back to the way things were before there was Obamacare, and that's mainly what this House bill is going to do. It's going to take us back to where we were before there was Obamacare, but with protection for people with pre-existing conditions and with some new subsidies.
And of course, Republicans, which we should mention is the president's party, they're hearing from a lot of their constituents that people actually do want to stay on this program in some cases. So in terms of how Republicans are getting that type of pressure, would any of the reforms they're proposing actually fix these problems? Doesn't sound like it from your perspective.
Well, that's the whole problem. You know, what people I think really want is they want their problems to be solved. They don't like high premiums. They don't like high deductibles. They don't like narrow networks. And the Republican plan is going to solve some of those problems a little bit. It's certainly not going to solve the race to the bottom in the narrow networks.
You know, as I mentioned, it's tough to talk about healthcare reform without talking about the political challenges, and this has become probably the signature issue that got the Republican Party elected in this country, now controlling all of government. Important to note that that was a big part of the politics, but in your opinion, what can these elected officials do to bring costs down with the politics at hand?
Well, we need a real market, and we need for cancer care, heart disease, diabetes. We need centers of excellence. We need them competing for patients to solve real problems. And what we ought to be doing, what the Republicans should be doing, is asking how can we create a market where people vigorously compete to solve our problems instead of running away from the sick people and trying to enroll only healthy people.
What about getting better healthcare results? I mean, the average American has really high expectations of how long they can live. They're often willing to pay for it, or at least willing for the insurance company to pay for it. How do you see the country getting better results? Because, in fact, there are a lot of other countries around the world that do get better results on healthcare.
Well, I think if you compare apples with apples, we do as well as anybody, and we have some of the best health care in the whole world. That's why so many world leaders come here for their health care. But we could be even better than we are, and I think we've got to let market forces work. An organization like Cancer Treatment Centers of America ought to be able to go to Blue Cross or Aetna and say, give us all your cancer patients. And,
it's a private provider, we should note.
Sure, and MD Anderson should compete against them. We should have competition to solve our problems.
All right. Well, we'll have to leave it there. It is a raging debate here in the United States. Our thanks to you, John Goodman from the Goodman Institute.
Thank you.